Okay, so welcome everybody to our annual state budget briefing for members here in Hobart, and we're also live streaming tonight to Launceston, which is a first. It's my pleasure now to invite Uncle Dougie Mansell to the lectern to give Welcome to Country. Uncle Dougie is a proud Tasmanian Aboriginal elder, musician and artist, so welcome Uncle Dougie.
Thank you. I don't know why, but I'm a bit nervous tonight. I haven't done a welcome for a while, but I guess when I do my welcome, I will be leaving. I don't think I'll be staying around because I had a major operation about a month ago, and I'm sort of a bit tender, as they would say. I'm not as tough as what I look. A little bit about myself before I do the welcome. I'm originally from Cape Barren Island. And I moved from there to Flinders Island when I was 5 years old, along with my parents and my brothers. Growing up in Flinders Island was a torture, the most racist place I've ever seen. So growing up in Flinders Island, you know, you were just belted every day by the non-Aboriginal children. And of course, when I got older, it was a bit different, but when you grow up around racism, you learn to live with it. And that's why now I'm not racist. I'm not racist against the white people, you know. So, and I've got probably more friends in the white community than what I have in the Aboriginal community, because the Aboriginal people don't like what I'm doing, some of the things. But I had to stop fighting people that were racist against me because I was getting too many bruises over myself. But you know, when I left Cape Barren in '58, and in 1963 was when the children were taken from their parents, unbeknownst to the parents, of course, because the school teacher on the island then was the school teacher, the police officer and the welfare officer. And of course, the parents were sitting home one night or one afternoon at 3 o'clock for the children to return from home. No one returned home. So they went around, just had no phone, so they walked to their friend's place and asked if their children had been there, and the answer was no. So they went along to school and asked the school teacher, and he said, "You won't see your children anymore." He said, "I called a plane," he said, "and I put them on the plane. You won't see them again." Some seen their parents, some didn't. So you just close your eyes and just think of what my people went through at that time, you know. And I think to myself now, if we hadn't left that island when we did, I'd probably, or most likely would have been one of those children that were taken. So I guess I'm one of the lucky ones. Right. Hello and welcome to Aboriginal land. Land, our sea and our waterways. My name is Uncle Dougie Mansell, and I am a very proud Tasmanian Aboriginal elder. I come from a strong line of Aboriginal people and can name my family through the generations. My family and extended families come from Cape Barren and Flinders Island. My people are Pakana, and my ancestors are Truwillian way. People, northeast coast of Tasmania. I deeply respect and acknowledge my old people, the traditional owners on this land, which we meet today. It is a privilege to stand on country of my old people's land. I acknowledge with deep respect the traditional owners of this land, which we meet today. The Mawinana people belong to the oldest continuing culture in the world. Their journey here is ancient. They cared and protected the country for thousands of years. They knew this land. They lived on this land and they died on these lands. I honour them. I acknowledge and pay respects to the Aboriginal people that did not make elder status. They are never forgotten. I acknowledge that it is a privilege to stand on country and walk in the footsteps of those before us. Beneath the mountain, among the gums and the waterways that continue to run through the veins of the Tasmanian Aboriginal community. I will continue to fight for Aboriginal justice and rights, paving the way for a strong future. I acknowledge the wider Tasmanian community for their support of my people across the country. I pay tribute to and remember our peoples connected to those places and country and the Lutruwita Aboriginal community who continues the legacy of our ancestors through health, education and justice. The influences and the sacrifices of our ancestors and elders who have walked the paths before us, who kept walking despite many barriers to leave a track for us to follow. These tracks or walking paths I am talking about are not a literal track, it is about our culture, our children, grandchildren and great-grandchildren, teaching them about their strong and their healthy Aboriginal blood. This event is so important in talking actions to improve focus on the mental health and well-being of Aboriginal people in Tasmania. You need to discuss the current gaps or challenge to help the government to identify opportunities for change to prevent the higher rate of my people continuing lower health rates to improve systems. I hope that Aboriginal representations will be consulted through the process to ensure that a culturally safe framework is included to better protect the Tasmanian Aboriginal community. Have a day of robust and transparent conversations. Today, it is with pride that I welcome you to Aboriginal land. Thank you.
Thank you so much for that warm welcome, Uncle Dougie. And I really want to express how grateful we are that you're here to share your culture with us today. And I'd also like to acknowledge the many other strong and powerful Tasmanian Aboriginal voices, both here today and right across our island. TasCOSS is drafting a statement of commitment to the Tasmanian Aboriginal people, and we would like to offer it to you once it's complete, Uncle Dougie. And this will include our commitment to working towards reconciliation and a treaty with the Tasmanian Aboriginal community, who continue to carry the work of their elders in caring for country and fighting for rights and recognition. It's on us, all of us, to lend support in this very important work. It's great to see so many of you here today in support of TasCOSS and the industry in our annual budget event. It really is quite a turnout, and we're particularly pleased to have our Launceston members join us tonight. I'd also like to make some special welcomes, and they are to the Deputy Premier and Minister for Community Services and Development, as well as Health, Mental Health and Wellbeing, Jeremy Rockliff, Paul Liggins, Principal, Deloitte Access Economics, and Paul's going to be joining us on the panel tonight. Award-winning journalist, Tasmanian journalist Emily Baker, who will moderate the panel, and we're very much looking forward to that. And we have a number of other politicians who are in the room in support of our industry tonight. Anita Dow, Deputy Labor Leader, Joanna Seeker, MLC, Shadow Minister for Community Services and Development, and Janie Finlay, MP. Also Cassie O'Connor, Leader of the Tasmanian Greens, and Rosalie Woodruff, MP. Also Independent Member for Nelson, Meg Webb, MLC, and Independent Member for Clark, Christy Johnston, MP. Jenny Gale is also joining us as the Secretary of the Department of Premier and Cabinet, and also TasCOSS board members. Alex McKenzie, who's the President of the TasCOSS board, is up in our Launceston event tonight, and I just also want to acknowledge our other board members who are both here and in Launceston. TasCOSS board member Noel Mundy, welcome Noel. And also the heartiest welcome, though, really goes to all of you, to our valued members. The true worth of the budget, of how effective the budget is, won't be determined tonight, or indeed in the days that follow. Effective budget should be a one-way transaction between the government and the community. Done well, budgets engage with the communities they affect. Done well, they have the capacity to be transformational, to set course for cultural change and structural reform. Without getting too caught up in the details of the budget right now, because we have got our stellar panel who'll be providing that for us a little bit later, I think it's fair to say that budgets, through their funding commitments, play an integral role in laying the foundations and creating the settings for change. Our state is benefiting from a remarkable post-COVID economic and jobs recovery, but we know that the gains are not benefiting everyone. Many Tasmanians are not able to grasp the opportunities on offer, often because the legacies of the past remain with us and too many Tasmanians are still being left behind. All Tasmanians want to live a good life, a life that is simply more than surviving from day to day. And this is the message that sits at the heart of TasCOSS's driving purpose. But as the pandemic has highlighted, the pursuit of a good life can be derailed by unexpected events. It's not always straightforward, and all too often there are barriers that get in the way and are beyond our control. Barriers such as a public transport system that's not shaped around where people need to go, inaccessible and unaffordable healthcare, and an education system not geared to engaging all learners. And these barriers are not going away. And you only have to look at the public housing wait list or the elective surgery blowouts and the numbers of people being turned away from homelessness services to see the extent of the problems we are grappling with. But I'm not here tonight to cast a long shadow. We know from our collective response during the pandemic what is possible and what can be achieved when we put the well-being of our population, their needs, their hopes, their aspirations at the centre of our decision-making. We've all seen evidence of it, and most recently I saw it when I was visiting one of our local jobs hubs, which are assisting, as we know, Tasmanians who are long-term unemployed to find work. James, it's not his real name, but he's a man who is in his late 20s. He came to the Jobs Hub at a very low ebb in his life. He was suffering from depression and he had suicidal thoughts, and a close family member of his had recently committed suicide. Through the Jobs Hub, James was referred to Standby, an organisation who provided him with support after the suicide, and later Beyond Blue to assist him with his depression. Fast forward, and with support networks now in place, James returned to the Jobs Hub with the goal of finding work in the hospitality industry. To assist him with this goal, the staff helped him to find a unique student identifier. They provided him with a mobile phone and data so potential employers could contact him, and they assisted him to complete his responsible service of alcohol accreditation. As a result of the skills and the confidence he'd acquired, James recently started work in a local hotel. The community services industry is doing everything in our capacity to support Tasmanians like James with what they need, but we can't do it alone. Solving entrenched issues in Tasmania such as poverty and inequality and the systemic problems that we're facing in healthcare, housing and education are not simple, and they won't be solved in one budget cycle, but they are possible to solve. We've seen evidence of what we're capable of through our collective pandemic response when industry, business and government work directly alongside Tasmanian communities. And there are some real green shoots of change in today's budget, such as the Child and Youth Wellbeing Strategy, which could make a material difference to the lives of thousands of Tasmanian children and young people, as well as things like an investment in food security and place-based programs that truly put people in the centre. Also, hugely significant is the funding that sits behind the community services workforce. And this was announced, as we know, in the state election, 3.3 million over 3 years to address the current skills shortage and create 4,000 new jobs by 2024. This significant investment in the care economy is in the well-being of our people is not only necessary, but it will generate a significant return on investment for government. This provides the economic validation for the important work that we're doing and will future-proof our industry for the long haul. But more importantly, it reflects more than a transactional approach to our industry and the people we serve. The funding will help to transform the way we work so we can keep putting Tasmanians at the centre of everything we do. While at first glance there are no real surprises in today's budget, what is evident is this budget demonstrates a commitment to doing things differently. There are significant initiatives in this budget that will benefit Tasmanians who are experiencing disadvantage in preventative health and in terms of growing and developing our peer mentor workforce with skills and training. But as welcome as the investments and the announcements are today, it does come with a caveat, and that is the true test of the budget is yet to come. The onus is now on our state government to measure the progress and the effectiveness of funding allocations against metrics that matter. Metrics that measure outcomes with regard to the well-being of our state's greatest asset, our people. Their voices need to be central as services, programs and supports are rolled out in the coming months. The Premier promised us a government of conviction and compassion, and he made it his priority to ensure Tasmanians, no matter where they live, their circumstances or background, will have the opportunity to benefit from our growing state. The community services industry is best placed to ensure the Premier's words are translated into reality for every Tasmanian by making sure that these opportunities are meaningful ones. So let's embed today's green shoots and work together across government and with communities, as we've successfully shown we can, to open up opportunities to tap into the real potential of every Tasmanian. I'd now like to hand over to the Honourable Jeremy Rockliff MP, Deputy Premier, Minister for Community Services and Development, Minister for Health and Minister for Mental Health and Wellbeing. Welcome, Minister.
Thank you very much, Adrienne. That's a great introduction and sets the scene very well for this afternoon discussion and forum. Can I thank Uncle Dougie for your welcome to country? And I also acknowledge and pay respects to the Tasmanian Aboriginal people as the traditional and original owners and continuing custodians of this land. And I pay my respects to elders past, present and emerging. And I'm also a little nervous. This is the first time I've addressed this forum, and I'm very pleased to do so with the number of hats that I have. Can I acknowledge all the MPs that are here today, and I will repeat who is here today, if it's all right. Joe Seeker, thank you. Janie Finlay, Anita Dow, Cassie O'Connor, who I think has been in my position before as Minister for Human Services a few years ago, Dr. Rosalie Woodruff, Christy Johnson, Meg Webb, MLC, and have I missed anyone else? Great. Excellent. I think we've got Alex McKenzie, the Board President of TasCOSS in Lonnie. Connie DeGolis is Vice President of TasCOSS. Board members of TasCOSS here. I know Noel's been acknowledged, but welcome everyone. Thank you very much for coming along this afternoon. More importantly, thanks very much for your dedication to communities right across Tasmania and for your interest in what is an essential sector in our Tasmanian community. And I congratulate you and the organisations that you represent for the work that you have done to keep Tasmanians healthy, safe, and under very difficult circumstances in the last 20 months, but most importantly, also connected. The Community Services and Development portfolio is kind of a new portfolio. I had sort of most of it, I think, for the last 18 months or so, and I've taken on extra responsibility, but it does align very well with my health and mental health and wellbeing responsibilities. And I acknowledge the challenges that we have, which you were very good at articulating as well as the positives. And I thought to myself, I'd been Education Minister for 7 years, taken on the health responsibility. So barriers to education and waiting lists, it's all my fault. It's all right. What have I been doing for the last 7 years? No, but there are many great things happening around Tasmania. And I do want to also thank you very much, Adrienne, for your real life experience in terms of presenting the lived experience of James, which is tremendous and a great example of the great work that community sectors do when we collaborate together alongside government services to support the many vulnerable Tasmanians in our community. I hope the initiatives reflected in the budget reflects support for your organisations. In many respects, it's a budget that is about delivering on our election commitments, and they were and are considerable. And I could list reams of millions of dollars and dot points and all those sorts of things, but I'm just not going to do it. I saw you on the lock-up today. I'm sure you're well across it, Adrienne, and others that have there, but I'll touch on some things, no doubt, in our forum a bit later on. But I'm pretty sure we're all here for the same reason, and that is to support Tasmanians, to support each other, to support all Tasmanians, and to ensure that everyone, particularly our more vulnerable Tasmanians, are supported and cared for. And I know, while we don't always necessarily look like we're agreeing on the floor of the House of the Parliament, I know that everyone that comes to Parliament has those values and, of course, objectives in mind as well. And I know all the people that are here today exactly those people. Indeed, our community sector peaks are vital, and we thank you for your leadership, your advocacy, and I acknowledge and thank you for your continued advice and engagement and support. And really, the budget and the positive initiatives, and no doubt many of you as individuals, the people you work with, the people that you speak to on a daily basis can highlight gaps and areas that we can do better in, and areas that we need to work harder to fill those gaps. But the areas that we have and are investing in is really down to your very strong goodwill, but most importantly, your very strong advocacy on the ground to MPs and, of course, ministers and government. So I hope the reflection of your hard work is seen in the budget. Expertise is, of course, paramount to the community sector. The value, particularly of lived experience, also cannot be underestimated, particularly for the community sector. I appreciate the many challenges that a number of many Tasmanians go through, whether that be physical challenges, geographical challenges, psychological challenges, whatever the case may be, not being connected across Tasmania. It's often, they don't like using the words understand because in comparison to many people, I've had a very privileged upbringing, and it's important to empathise, but it's hard to truly understand what people are going through in very challenging circumstances, but we try our best to walk with the people. Is that a bell? Because I won't be long. So you all bring your work, and some of that, of course, is lived experience to your work, and that's what helps connect us. And the word lived experience is a new sort of thing that's come into my vocabulary over the course of the last couple of years, as it probably has yours as well. But I'm increasingly mindful of the fact, as I work with organisations such as the ATDC, but also the Mental Health Council of Tasmania, and the importance of peer workforce as well is becoming increasingly important. And in the mental health sector, for example, our peer workforce strategy with Connie and I launched in around November 2019. It's pleased to see some investments there in the budget in terms of that, as well as the ATDC and meeting some peer workers there at their recent state conference. So I have got a couple of figures, $10 million for this sector in the budget, fulfilling what we promised during the election, and I've no doubt will be discussed tonight. More than ever, it's important, notwithstanding the advocacy, which is essential, that where we can, your industry and government working together is absolutely critical to ensure that the work that you do, your industry remains resilient and well prepared to respond to the ongoing challenges, not only of the pandemic, but the many challenges we faced prior to the pandemic. And, you know, a number of those have only been accentuated by what we've all experienced. You mentioned the Community Services Industry Plan. That's an example of how we can very much, government and the industry can take a partnership approach to build inclusive and resilient communities for all Tasmanians. You've mentioned the $3.3 million over 3 years to assist the workforce priorities and to meet industry projections of an additional 4,000 jobs by 2024. So thank you for the work. We're committed to working with you to address disadvantage within our communities, support inclusive communities, and very importantly, also embrace diversity. We want to ensure that all Tasmanians have that opportunity to participate in the social, cultural and economic life in Tasmania. And I hope that there is some recognition that our budget demonstrates this commitment. We have all worked together and achieved a lot in many respects over the last 20 months, particularly, which other jurisdictions perhaps wish they could have achieved right now. But I would like to take the opportunity to thank you all, the non-for-profit sector, organisations that you represent have really stepped up to the plate enormously, particularly in the last 20 months, as indeed as our public service as well. We, irrespective of what colour of political persuasion, whoever's in government this time, I take my hat off to the many leaders across our public service and the many people on the ground in the public service that have done such an outstanding job. And often our public service don't get the accolades that they absolutely deserve. But I want to reflect that, but also the great work that our community sectors have done as well. And I look forward to the forum, I think. Thank you.
Thank you, Minister. It's really good to have that overview. And I'm now going to hand over to our moderator for tonight, Emily Baker.
I'm a bit shorter than everyone else, sorry. And bear with me, the Minister's taken my joke about feeling nervous, so I won't do that. But thank you, Uncle Dougie, as well, for the welcome to country, and I too acknowledge Tasmanian Aboriginal people. And just wanted to say that it's a real honour to be here today. I think obviously the community sector is such an important sector and one that's played a really big role in my life. So just quickly, born to teen parents, I've got a parent still in public housing, lots of challenges within my own family, and I'm really personally grateful for all the work that everyone does, and we can see what a difference it makes across the community every day. So thank you. Now, I was going to tell the Minister that he wasn't allowed to say unprecedented or talk about numbers too much because I think it gets a bit boring, but it sounds like he's already on that page. So again, yes, great. But we've got an empty chair here, so I'd like to welcome Paul Liggins from Deloitte Access Economics Tasmania, who will talk us through what a budget actually means. So we'll obviously have questions from the audience tonight. I get to ask questions all the time. So to politicians, I should note, so I think we should help leave it to the sector. But I'll kick off today by asking a question to the Minister. We saw the Tasmania statement released earlier this month, and it talked about addressing poverty and how important it is to address poverty for current and future generations. Has your government today delivered the course correcting budget that we need?
Thank you, Emily. Well, I believe it has, and certainly a very strong start to that. Now, we would argue, of course, that we've been building on those very important investments to ensure that we do what we can to end poverty. I mean, that's got to be the ultimate objective, not reduce it, but end it. I want to be very, very clear about that. But if I can focus on this budget, and notwithstanding the pressures on housing that have been increasing over the course of the last 7 years, housing affordability, for example, the commitment, significant commitment of investment, the fact that the 2027 objective of 3,500 houses constructed, I think is very important. More broadly, in other areas of my responsibility, great to see that the housing initiative, as an example, in the mental health and wellbeing portfolio, which supports and accommodates people experiencing mental illness, is very important. When I look at the food security strategy that we released just a few days ago, in actual fact, and the $5 million to support food security, including, of course, I think it's 1.4 million, Julie, isn't it, for the school lunch? Yes.
Oh, congratulations.
And I know you got very excited about that. What, but it's 1.4 of a $5 million initiative. And, but look, that's a very good example. If I mind, put my education hat on for just a second. And of course, there's no better expert in the room than Julie when it comes to supporting the provision of food within our schools and healthy food. But the pilot that was undertaken to support that investment of $1.4 million, when you looked at individual students that were absolutely serial non-attenders at school, didn't turn up. But through the provision of lunchtime, and I can think of a couple examples, but one particularly struck me was once that provision was made, this young person attended school every day that was available. And so any government presented with that evidence and data could not do anything more than want to continue to invest in those areas. I could talk more about power concessions and such, and reducing barriers to education as well. And Adrienne, we mentioned education, and we can talk about investment in reducing those barriers, and trauma is one of those, which is the significant investment in this budget. And that is a significant barrier, as is the barrier of disability as well, which we've been investing in the last few years. But more broadly, which was started under Nick's time, I think, Cassie, that fairer funding model and that application to schools and resourcing our schools in areas of disadvantage continues based on that Gonski model, and that needs to continue. And as Education Minister, I always said that education was the silver bullet to addressing many of these challenges, including the challenge of poverty, and we need to continue investing and make sure education is accessible, but accessible before birth, really, to achieve not only the poverty, but also if I could invest $1 very early on, I know that our prison population, for example, would be a lot less in many years to come as well. So I'll leave it at that, but I can. I'll leave it at that.
I think that's good. Thank you. Maybe to Paul now. So what does a budget tell us? What does it show us about a government's priorities, and what stuck out to you this year?
Thank you, Emily. Is that on? Yes, yep. Thank you. Yeah, I mean, ultimately a budget is a reflection of the government's priorities and the choices that the government makes, you know, not only between what sectors is it going to spend the money on this year, but what decisions is it making in terms of benefits and costs for today's generations, but generations down the track. So every budget comes with a million little decisions about priorities, who's going to benefit, who's going to bear the costs, and what the implications will be for the community going forward. This budget for me was not an unexpected budget, and you know that's a good thing to some extent. It's not all governments who come in with a platform during an election and then actually deliver on what they said they would do. So the government deserves a lot of credit for that. It spends money in areas that I'm happy to see money being spent. Health and community services has got a boost, and that's a very good thing. There's more money for preventative health, which is something that I've been banging on for a little while. Are we where we need to be in terms of spending on health? Everybody would love to spend more in that area. The Grants Commission reckoned a couple of years ago that Tasmania was probably underspending on health by about 10% compared to where it needed to be. We probably made up a large chunk of that gap, but there's probably more that can be done in a range of areas. But no, I was quite pleased with the budget. The Tasmanian government is in a pretty good place at the moment. We've come through COVID well. Due to a little bit of good luck, but a lot of good management. The Tasmanian government went hard in terms of supporting the community in the past 18 months, harder than just about any other state government in the country, and that's been a good thing. We have very low state debt, so that gives the opportunity to introduce some deficits, and interest rates are very low at the moment. So now's a good time to be spending money, and the government's in a good place to do that. So, yeah, look, everyone has their own priorities and thoughts about a budget, but from where I sit, it's a pretty good one.
And Adrienne, your thoughts? So you've been locked in a room with other stakeholders all day, lucky you, reading through these budget papers. What stuck out to you? You've been working, I think, quite closely with the government in the last 12 months. Do you think that the community sector has been heard? And if yes or no, how is that demonstrated?
Yeah, well, I think what we heard over the last few days was that we wouldn't see any surprises in today's budget, and that certainly was true. There was pretty much, I thought it was a bit of a catch-all for a lot of the announcements that have been made, particularly over the election campaign, but also through PESRAC. And I have to say, for me, it was heartening to see those in black and white and to see that the government was serious about delivering on some of those announcements. Certainly in the community services room that I was in this afternoon, there was some pretty positive responses to what people saw in the budget. And I think from our point of view, it really is starting to reflect a lot of the conversations that we as a community services industry have been having for a number of years now. And that's particularly, this aspect about, and the Minister talked about lived experience and not making assumptions about what it's like to live with poverty and inequality. But actually really putting people at the centre. Now, I think there was a real willingness to do that, to put people at the centre, but also to acknowledge that the expertise is out there in communities, and we really need to build on that rather than kind of going in and thinking we know all the answers. But I think the other thing for me was some real and I talked in the speech about some green shoots, if you like, but really for me that was about seeing some strategy, some approaches to solving some of our problems that we have here in Tasmania, and not doing it in a one-off way, but thinking about that in a systemic and strategic way. So we were really pleased to see things like the child and family strategy, but also the investment in that that peer workforce, and also the community health and wellbeing networks, that mental health, that the health consumers TAS going to be working on. So yeah, there was a lot of positive things in today's budget.
And just briefly before we move to the audience for questions. I think the Minister made what was a funny joke about where have we been for the last 7 years, but and I've got a bit of a negative ABC hat on, but just quickly. But we look at things like this strategy around child and family wellbeing, or a 2-year housing strategy. Why are these things happening now, and why haven't they happened sooner?
Very good question. Good question. Okay, so if I can think back 7 years, Emily, and I guess without going through the whole history of, we would have liked, our first budgets were about addressing budget sustainability, and we had to make some difficult decisions. And I guess as Minister of Education, I felt the brunt of that in terms of, initially a reduction of teachers in schools, and that was a challenge. But we recognised also that we had to invest in other key areas such as health and the commitments we made at the 2014 election. The housing situation really started to bite pretty hard towards the end of 2017-18, if I recall, notwithstanding trying to get funding out the door. And if I could really try and wave a magic wand and wish we could find a way to get more funding out the door sooner over the course of the last 7 years, which we're trying to address and have improved in terms of infrastructure in the last few years. I wish we could have done that. But communities evolve, and different circumstances, different needs. And what we don't really want is, a strategy that is written and then, sits on the shelf, and there'll always be need for continuous improvement. I'm not happy, but I acknowledge the criticism that may come. But I think we're at a turning point now, and perhaps the pandemic, there's no silver linings to a pandemic. But if there was one, it was a real realisation that irrespective of where you were or are, or your circumstance or background within our community, everyone really had to pull together and work together. And I believe there was a very strong acknowledgement from all of us that we need to do a lot better to support more vulnerable people, or people experiencing vulnerability in our community. And there is an economic and social benefit to that as well, in terms of investing in housing and the like. So happy to acknowledge the criticism in that sense, but really looking forward to the plans we've produced. Food security is an example of that. The mental health investments, and which I'm very, very proud of, which we're committed to in terms of the child and adolescent mental health services last year. But I'm very conscious of the fact that not only was this happening anyway, but the wave of the pandemic, I'm just seeing a wave of need really in that mental health space. And we're right and primed, I think, to deliver on what we've committed to. And I'm very pleased to see those investments and those reforms happening, because they're much, much, much needed.
And Paul, just briefly, does that make sense to you, how the Minister has framed that?
Yeah, look, I think so. For a few years there, the budget was in a little bit of a poor position, and that was largely due to external factors. Tasmania really suffered after the GFC. People left the state. Exchange rate turned against us, and population growth was very weak, and there wasn't a lot of need for investment in things like housing, for example. But things have changed pretty quickly over the past few years. The economy's come back in Tasmania. We did some work a couple of years ago on the Tasmania report for the TCCI and TasCOSS, and we showed that things have definitely improved on the economic and financial position of the state, both for individuals and the state government. But the social indicators, we just hadn't caught up to the rest of the country, and I think now the government has recognised that and is taking those actions to catch up on those things. But yeah, it takes, it takes a long time to turn things around. Tasmania, particularly when it comes to things like education, we've got long-term intergenerational issues that can't be turned around very quickly. When it comes to spending on infrastructure, the government only spent about 60% last year for what it said it would do in the last budget, but it is difficult to get the money out the door sometimes. Trying to do it in a pandemic doesn't help, obviously, and I've been involved in some of the work with state growth to try and get that money out the door. So yeah, I think it's easy to be wise in hindsight, but a lot of the things have been sort of bubbling away for a while and have only come to head in the last few years.
Great, thank you. Now, Cameron Allen should be somewhere with a microphone. I'm told he's a shrinking violet, but I've been to karaoke with him and I don't think that's true. Now, do we have any questions in the Hobart audience to start? There's one.
Jones, Secretary of the Tasmanian Association of State Schools Association. To Jeremy, who was the former Education Minister, during the COVID, you dropped school fees and then brought in a policy where you upped it, where parents who have the healthcare card wouldn't have to pay school fees. But what we're finding is that those parents that don't quite qualify for that, but are doing it really, really tough at the moment, the families that are paying huge private rents, struggling with their mortgage payments and health costs. Is there any chance that in the future that you might seriously as a government look at scrapping school fees for state schools? Because now it's only a small proportion of parents that are paying school fees, and increasing the free lunch for students in state schools. So we're picking up a more pocket full of kids coming through and improving better educational outcomes.
And to the Minister.
Thanks, Nigel, and thanks also for the work that you and I think Deb's sitting next to you as well, of TASO. I'll take the last part of your question first on the school lunches, and I've no doubt that with greater knowledge, if you like, and evaluation is the word I'm looking for, of what we're rolling out now, that there will be an extension to the school lunch program. Julie will keep us accountable to that, but what we're committed to will be further evaluated, and I've got no doubt that that need will be ever present. The waiving of school fees during the pandemic was, if memory serves me correctly, about a $13 million cost to the government, but much needed. Working alongside that, at the same time, there was a review of school fees done, as you've alluded to, and what we tried to do with that review, and I think reasonably successfully, notwithstanding, of course, you could always highlight need, was trying to create a more equitable system. And my understanding is a reasonably average look at that if you had a family with 3 children at a public school under under $50,000 worth of income, that could have possibly been a saving of around $1,200 a year from memory. So significant in that sense, and extending it to healthcare card holders in terms of that criteria supported a lot more families. 9,000 more students or families, I think, from memory, plucking these figures out of the top of my head, but I think they're about right. So I'm happy where we've moved to. It will be considerably more investment will be required to completely abolish school fees, and then we would have to also work through a system of some fees are inclusive of excursions and some are not, depending on the school. And so it's not as easy as it might first appear, but I think we have made significant progress in the last few years on the basis of equity.
Great. Do we have any other questions around that in particular here or in Launceston? I might ask Adrienne to pick up on that theme of equity then and equity in education. What have we seen in this year's budget, Adrienne, that will help everyone access education? We spoke earlier about the importance of the early years, which I think everyone would agree with. Is there more we can do or anything you want to pat the government on the back for in relation to this budget?
Look, I think the child and youth wellbeing strategy has been long overdue, and I think that one of the great things about that was the process. The consultation process that they went through was really thorough and asking young people themselves what they needed, as well as families. So I think that, look, we know that equality in education is not the case, that many children starting school behind the 8 ball and not having the opportunities and the benefits of early years education that they really need. So we certainly welcome the announcement of the Child and Youth Wellbeing Strategy.
And just another one to the Minister. So we heard through the PESRAC process about during the pandemic and during the very short lockdown comparatively that we had in Tasmania, issues for some family with digital access and digital inclusion. What more is your government or will your government do to increase this measure on which we lag quite significantly behind other states and territories?
Thanks, Emily. And insightful question. And we have, under the responsibility of Minister Ferguson, we have a digital inclusion strategy. Mindful of what happened during the pandemic and the disconnection there, but largely thanks to the good work of and goodwill of our principals and teachers, we were able to reach most of our students, and those that did not have access to devices, of course, we had supports from government and supports from Telstra and the like as well, which was very positive. And outside of that, also physical packages of education were provided to more vulnerable families as well. It did highlight a gap though, however, but it also highlighted to me that students also learn differently. And some of our students, in fact, our high school students that were learning from home, my feedback is that, and there's examples of it where we had students that engaged in education for the first time ever because they felt in a comfortable environment, and sometimes the classroom is not a comfortable environment for individual students. So that was also insightful.
If I could just add, if there was one area of the budget we did see a gap, it would have been in digital inclusion. And we know that by the Digital Inclusion Index that we know Tasmania sits at the bottom of the barrel in terms of digital inclusion, and we have for some years now. So that's certainly something that we would like to see some more significant investments in. We saw in the budget there was an increase, which was good, but I guess when we compared it to the amount of funding that goes to digital ready for business programs in comparison to what we're seeing in ready for daily life, there was really no comparison. So I think that in this day and age, digital services are essential services. They're something that we all need not just to look for work, but also to engage in education and also participate in the community. So I think there's probably some space there where we could have some improvement.
And if anyone has a question, please just put your hand up. I'm not hiding it very well, but this is my first time moderating a panel. And I'm much more used to talking to people who I can't see through a camera. So please feel free to interact back because I'm very nosy and I can ask questions all day. Now, we might have one in Launceston. Yes, and I'm from Launceston, so I'm going to choose them.
Thanks, Emily, although I'm from Hobart. Minister, we've raised with you before the gap that exists between what the NDIS will fund and what the state government's mental health services will fund. where is your thinking up to and the think of your government about funding the gap that exists for Tasmanians who are missing out?
With respect to mental illness, Chris?
Yes, Chair.
And the
Yes,
NDIS.
Minister. Yeah. So, as you know, some are funded by the NDIS, some are funded by State Health. We've got people falling between the gaps. What are we going to do?
Well, firstly, we need to recognise where exactly those gaps are, Chris, and that's about talking to service providers and indeed the NDIS as well. Now, we're very strong advocates for the NDIS. In fact, I think this budget puts in some $1 billion into the NDIS, and we have probably now around 11,000 people or more on the NDIS now. Ingrid's nodding her head there. And so the work needs to be done to see where exactly those gaps are, Chris, and yes, we've spoken about that before. I would like to think that the investment we're making in mental health, which is unprecedented in that sense, would go some way to addressing some of those gaps, albeit I recognise the increasing demand in that space, particularly in our young people and adolescents, but more broadly as well. And so I'll just have to take that one as something we need to work harder on with respect to that matter. And once again, you've raised it with me. And so, but look, we recognise we need to do more, but I am particularly pleased with as well in that space is also a disability commissioner that we've committed to as well, and some significant investment to see that that is implemented, which will highlight again an opportunity just by that very position, would highlight the gaps that need to continue to be filled. And so I'm very pleased to announce that as Minister for Disability just prior to the election, and to see it committed and funding committed to deliver it is also very pleasing. And again, there were a number of advocates, Kristen Desmond and others, that advocated very strongly for that, and I thank them for it.
Great. I saw a hand up in Hobart. Is that hand still up? I might have imagined it. It's been a very long day. Oh, there's one. So I'll just get Cameron to bring the microphone over here, and I'll just get you to introduce yourself.
Hi, everyone. It's Heather McCallum from Housing Choices. A question for Paul, I think, sort of on an economic level. I guess the saying, never waste a crisis, you know, that at the one end of the spectrum, and the other end, I guess, is looking generations down the track, having to bear the burden of debt and deficit. And I just wondered your views on, have we gone far enough to address some of these really systemic issues? We've obviously got a lot of goodwill and working between government and community sectors across all different areas of need. Have we gone far enough in this around some of those pivotal areas in terms of investing in health, communities, and housing? Obviously is a particular interest, but digital strategy, any of the gaps? Was there room to go further, or got the balance right?
There definitely is room. Definitely is room to go further. As I said, the Tasmanian government budget is in a pretty good place, and you know, borrowings are a lot less than in other states. So there would definitely be capacity to, you know, borrow more now and invest more. And as you say, you know, there's a number of priority areas that do need urgent work. You know, some of it's about building stuff, as you say, community housing is really important, and the government has committed to building I think 500 houses per year. You know, the other area where the government can do work, I think, is working on planning laws, working with councils. Local government reform is something that I'm very keen on. Greater opportunities for medium density housing in inner city areas to bring the cost of housing down for everybody. You know, the supporting skills acquisition and training in the construction sector when it comes to housing as well, I think are some of the things that can be done at very low cost in the short term, but will have, you know, lasting benefits as well. But, you know, Could the government borrow more to invest more, particularly on preventative measures in health and housing and other community services? Yes, it definitely has the capacity to do that. And I think it's a matter of, finding out what are the priorities and what needs to be done. I'd encourage governments, and these are all governments, to, experiment a little more, try things, run pilots, particularly when it comes to health. There are a lot of things that can be done that have been successfully trialled in other states that could be picked up in Tasmania. I know the University of Tasmania is doing some really interesting work around preventative health measures. It'd be good, for me, it would be good to see governments just doing a little more, doing some things, thinking outside the square, and, accepting that they're going to fail occasionally. And, that's almost becoming more and more difficult to do in this age of social media and criticism. But, having a crack, particularly in the area of preventative health, the school lunches is a great one where, you do a pilot, test how it goes, and if it's a success, you pick it up, because, almost everywhere you look in terms of preventative health and, particularly when it comes to spending on mental health, prevention, it just reaps so much rewards in the long term, both on the government budget, but, obviously for the individuals concerned and their families. So could the government do more? Yes, I think they could. The capacity exists to do that. And it's a matter of, finding out what are the right things to do and getting on with it. And as I say, trying and failing occasionally as well.
So, Minister, we'll need you to respond to that. We've had an economist say that you can do more, that there is space to move. Take us to the Treasury rooms, big chambers, I'm sure, where you all argue about where you're spending money and make decisions. How or why don't we spend more? Where are the risks? How do you come to these decisions? And can you respond to what Paul said now?
Yes, I can. Cassie's been a minister before, and difficult decisions are made around the cabinet table. Each minister is very passionate about their area of responsibility, and sometimes those decisions are, challenging because you'd like to be able to address every single need that it's presented to you. There is a balance. There is a balance in terms of sustainability of budgets. So we can spend a lot of money, but it might come back to bite us in 10 years' time, and then we take many steps back, not forward. So it is a bit of a balancing act. I do think, I believe Paul's very much on the right track in terms of having a crack. Pilots are good things to do, and I like change and looking at new ways of doing things. And Paul mentioned areas in health and preventative health. I mentioned that a few times, Paul, so we need to catch up on that. But this is a $20 million investment we're putting into preventative health this year, and that is significant. And as Health Minister, I'm conscious of the fact that there are too many people, for example, presenting to our emergency department. I had a question from Rosalie today on that in the Parliament, with 6 or more chronic illnesses, and they come back. And it's an area that we need to invest a lot more in. The Premier's Advisory Council on Preventative Health, the Premier, myself and Graham Lynch signed a commitment again the other day to address a number of these matters. That will require more investment, but we've come some way. But even in the sense of different ways of providing healthcare, and hospital and the home, for example, the COMAS, Community Rapid Response Initiative, which was, I think, trialled in Launceston, and that's about supporting more people in the home with their care, with nurse and GP. And that was successful in the northern Tasmania, was trialled again in northwest and Hobart, and now it is committed to statewide. So there's an example, of course. We have our critical response service, In the mental health, for example, I don't think it's quite the right word I've got for it there, but it's of that nature, which is very new, one of 3 in the world, and it's based on a model in ACT called the PACER model, where you effectively have paramedics, but also police and other emergency services and health professionals attending to a person's need that is having a mental health episode. And that system, by all the evaluation, looks very successful in keeping people with mental illness out of our emergency departments. And the figures that I've seen is dramatic in that, which is why we're introducing it, hopefully getting it up and running by the end of this year. Our ambulance service, for example, and secondary triage, which is a new thing, again, important in terms of, and that was started this year, in terms of triaging the calls that come in and reducing the number of people presenting to the emergency department that can otherwise be cared for in the community. And notwithstanding the importance of our acute care setting, and we can talk about that investment at some time, if you like, in elective surgery and all the other important matters within our hospital environment, but more and more, including mental health and other acute care health, we're going to need to provide more and more care out there in the community, but also have a greater collaboration, if you like, communication between our primary and secondary care as well, which amazingly in 2021 still doesn't happen as well as it should. And, you know, AMA are advocates for single health funder models and all these sorts of things that might reduce that, which will be challenging. But to Paul's point around trying things and having a crack, I think Tasmania is very well positioned to do that as a small state. And certainly I'm very open to communicating with my respective ministers, including the Minister for Health, and saying, look, what can we try in Tasmania that is new to... Sorry?
You are the Minister for Health.
Me, myself and I. Greg Hunt. Greg Hunt, sorry. Yeah, sorry. Minister Hunt. Thanks for pointing that out. About, you know, possibilities, what we can trial down here, innovative approaches to healthcare, which is only going to increase in demand. And, you know, it's about 32 or 3 or probably more now % of our budget. When we started budgets in our time, it was 25%. And so one can soon see it rapidly swallowing up the budget if we don't address some critical areas, particularly in the health area of what I like to call ill health prevention.
So you've talked there, Minister, and please shoot hands up, whatever you need to do. But you've talked there about how spending money can come back to bite you, but I think we can see that not spending money can really come back to bite us as well. For example, I'm old enough to remember Michael Ferguson's elective surgery waiting blitz. And that worked short term, and then we saw it grow again. Adrienne, is it frustrating, and I'm sure people in this room can answer, to see that these issues have solutions around election times or around budgets? We'll be looking for a longer term focus from our government and from our opposition.
Yeah, and I guess what I've been kind of reflecting on while we've been hearing Minister and Paul speak is, and it was just an example that came up at TasCOSS recently around food security, where TasCOSS staff facilitated a consultation session at one of the neighbourhood houses. It was actually about household energy efficiency. But one of the questions was, has anybody here skipped a meal over the last week because they couldn't afford to pay it, or they were prioritising getting their medicine or going to the doctor over that? And every single person in that room had to skip a meal over the last week because they couldn't afford to buy food. So I guess I just want to make sure that we're keeping those sorts of things front and centre of all of our decision making and all of our policy making, because it's about recognising that and embedding everything in. making sure that we're having that at the back of our mind all the time, that not everybody can access the same opportunities. And for some people out there, it's really tough. So we need to be kind of keeping that in at all times. And this is about the long haul.
Absolutely. Now, everyone, this is your chance to ask the Minister anything you want. There we go.
You first, if you just give your name, organisation and who you question.
This is a question for the Minister, Tracy Matthews. I'm representing Housing Connect tonight. This is actually a general question. What assumptions have been made in the forward estimates for the impact or potential impact of the ongoing COVID crisis?
Well, it's uncharted waters in many respects. We have COVID provision of some $150 million, if my memory serves me correctly, which is important. So that's one example of it. I mean, all the economic assumptions that are made within the budget, we believe are true and correct, and to the best of our knowledge at this present time. But I think one of the challenging things is, and I'll take up Emily's point about not investing in things, and I'm not avoiding your question because I think I've kind of answered it with the 150 million, but I'm sure you want more. But we had to cancel elective surgery during the height of COVID, for example, and that not spending that funding did have a very big impact, of which we're paying for now. Now, it was the right decision and under the circumstances, but our waiting lists went up to 12,500 or more, and now about 11,600. So that's an example of something coming back to bite you, although the decision was made for a very good reason, but an example of not investing sustainably, if I can put it that way. On that point, very quickly, and Emily's point on blitzes, and yes, they work, but what we need to see with blitzes is they are not blitzes, but they continue. And we're able to, in this budget, invest more funding in health for elective surgery without the peaks and troughs, which we've added to in this budget, announced it last few days. So we can actually, the clinicians themselves who do the work and the statewide perioperative and surgical committee have sat down knowing full well the knowledge of the forward estimates and able to present for the first time an elective surgery plan that is sustainable without the money going in and then not continuing to go in. And that will get our waiting list down to a sustainable level and will be achieved by addressing those 30,000 elective surgeries and endoscopies over the course of the next 4 years. So that's an example to your point. I don't want Delta to hit these shores. Now, it's likely that it will. The Premier has said that. We'll do everything we can to keep it out. But what would the consequences be in terms of what I've just said, in terms of cancelling elective surgery again, and people get sicker on waiting lists and they're outside the clinically recommended timeframes, and that's not good. So they're difficult to plan for, except we need to plan for getting as many people vaccinated as possible. So when Delta does hit our shores, that people are not requiring the intensive care support that the Delta variant or COVID-19 required when it first hit our shores 18 or 20 months ago.
Great. And we had another question, I think, from Patty. No.
Patty. Hello. That's still not.
No, I think you just need to hold it up. Yep.
Sorry about that. Hello, Patty Choke from Tasmania. So surprised, going to ask a question around housing. And obviously COVID has taught us the importance of everyone having a safe, secure home and somewhere they can isolate and be protected. I'm really pleased to see the 615 million in the state government. I mean, it is a great investment, and the growth to allow the growth of community housing, which is one of the highlights of our sector at the moment. But I also noticed in the budget lockup, there's quite a windfall in stamp duty. There was, I think, 48 point something million, so it's 16 million above 317 in stamp duty. And we were talking just before about innovative practices and opportunities to do projects. So it's sort of a question to all of you. One, I suppose, first to the Minister, would that that money be committed to affordable housing and projects? And maybe to Paul about, you know, if we're looking, what sort of funding would we need to look at some innovative projects? And Adriana, if you'd like to add anything to that. Thank you.
So, Minister, where's that extra money going?
Well, extra money is going to the investments that we've committed to throughout the last election, and indeed further commitments.
Sorry, where's the stamp duty windfall going?
Well, the stamp duty goes into consolidated revenue, and there we make decisions about where we best apply those funds. Now, for example, notwithstanding our commitments we made to the last election, yes, additional funds through stamp duty. And part of those funds, for example, with my hat on, and more broadly, revenue coming into government, has enabled me to work with the Treasurer to find an additional $300 million to invest into health, for example, over the next 4 years. And so that's an example of where windfalls can go and be further invested in above what we committed to at the last election.
And we'll get Paul to answer briefly, and then we'll get one more question from Launceston.
Thank you, Emily. Yeah, look, I guess, you know, I have a lot of sympathy for the government in terms of preparing a budget at the moment because things are so uncertain. We don't know what's happening with the COVID. We don't know when tourists are going to return. We don't know when international students are going to return. So making predictions about, you know, population growth and a whole range of things is extremely difficult at the moment. And that sort of applies triply, I think, to stamp duty revenues, which are difficult enough to forecast at the best of times, let alone at the moment. My general view on the hypothecation of revenue from specific sources and spending on specific items is that, you know, it's generally not a good idea. As a general rule, prefer to see it go into consolidated revenue and then, you know, the government to make the decision about what's the best use of that money, which may well be community housing, but, you know, maybe something else. So, you know, the government is benefiting from higher house prices at the moment. Whether that will last, who knows? And, you know, look, as an economist, economists hate stamp duty as a tax as a general rule. We much prefer flatter taxes, such as land tax, for example, for a number of technical economist type reasons. So I guess to answer the question, yeah, the stamp duty windfall has been great for the government last year and will probably continue for a while. But, you know, tying it to a particular community housing initiative, I'm not sure is a great idea in the short term or the long term, particularly given that, you know, it might fall away as well going forward. Sure.
Great. And do we have any questions in beautiful Launceston? So just yourself.
Yes, we do.
Great.
Minister, Yvette Seatle from the Women's Legal Service in Launceston. My question is to say thank you for the 2.2 million that was promised during the state election that's been delivered to the legal assistance sector. But we've talked a lot about equality and equity tonight, which is pleasing to hear you talk about that. And I'm really curious to find out if around the table there's been a discussion about gender equity and equality. And whether there's been a focus on looking at what women's specialist services across the community sector provide. So looking at housing, counselling, legal services and sexual assault services.
Minister.
Thank you. And thanks very much for the acknowledgement of the investment. Just on the last question, we've got $3.4 million of core funding into sexual assault support services, including Laurel House, $250,000 each, is that right, for SAS and Laurel House, and $1.25 million for harmful behaviours, and new family and sexual violence action plan to be delivered. More broadly on access to health services, we could talk about the announcement today around reproductive health and making and ensuring our vulnerable women have access to surgical terminations statewide in the public system. And so I'm very pleased about that. More broadly, yes, we do have discussions around our table about gender equity, and part of that is ensuring that we support better representation of females across governments in terms of women on boards strategy and the like, which has been reasonably successful over the course of the last few years. So, yes, we do have those discussions and we're doing all right, but we need to do better. There's still some way to go.
We're 14 minutes over time, so I probably won't be asked back to moderate anytime soon. Sorry about that. But thank you very much, everyone. I think that's where I'm meant to wrap things up. So thank you very much to the Minister, to Adrienne, of course, and to Paul for joining us this evening. Hopefully it's been enlightening.
Thank you so much, Emily. It was really great to have you as part of that discussion, and your nosy ways were really great to have. It was great to good to dig into some of those issues and really kind of drill down and understand some of the thinking, particularly behind some of those budget decisions. So I thought it was a really great discussion. Before we close, I'd really just like to acknowledge the TasCOSS team, who really do embody the values of integrity, compassion and influence in absolutely everything they do. And I'd also like to thank you, our valued members, for coming along tonight, for supporting us in the work that we do, not just tonight, but all through the year. So thank you both to you here in Hobart and also in Launceston. And we really look forward to gathering with you all again next year. And I invite you all to stay. I think we're still allowed to stay for another drink, but yes, please stay for drinks and nibbles. And thank you all and good night.